Who is teaching us to really know ourselves? Dr. Rene Samaniego says this covers, and I quote, identifying individual stress triggers, setting realistic personal goals and limits, and being firm about them. And then, finally, developing the skills to effectively manage anxiety. Dr. Samaniego is a renowned Filipino psychiatrist. Last February, during the 7th World Congress of the Asian Federation of Psychiatric Associations held in Sydney, Australia, he received an award of excellence for exceptional contributions. He will give us a glimpse of the mental health scenario in the Philippines today and tell us about mechanisms that individuals like us, or families, or communities, and businesses can access to effectively address this growing concern. Dr. Samaniego, Dr. Rene, right, is past president of the Philippine Psychiatric Association and currently Secretary for Education and Training of the Asian Federation of Psychiatric Associations. He is also currently a consultant of the Makati Medical Center. You can't hear me in the back? Okay, thank you. Okay. For the Brahma Kumaris, Dr. Samaniego is a rare and precious find. As much for these achievements that we have also mentioned, as for the fact that while he is a man of science, trained and well-versed in clinical methods, he advocates the practice of calming the mind through a sustained reflective practice like meditation for more lasting benefits. His words. For good reasons, then, we are very, very proud to introduce to you our first speaker. Please welcome Dr. Rene Samaniego, or Dr. Rene.
Good evening. How's everybody doing tonight? So first off, please allow me to just quickly thank Brahma Kumaris for this invitation and wonderful opportunity to be able to share with you all tonight a little bit of my expertise as a psychiatrist and a mental health professional. I just want to say that I've actually been attending BK events myself for a while now. And whenever I do, I always leave it and take away very valuable insights on spirituality and just life in general. So this is, in fact, an exciting moment for me because personally, for the very first time, I, in turn, am sharing something to the BK audience. In fact, just last year, I was invited to attend their 5-day silent retreat called the COTT, or Call of the Time retreat, which, if I may say so, was one of the retreats that have really made a significant impact on my overall well-being. Physically, for one, I really felt rested and rejuvenated. So I was telling Sister Jayanti earlier that at that point, I just finished my term as the president of the Philippine Psychiatric Association. So it was a phase of my life where I was just coming down from a very frantic and hectic phase. And so it gave me an opportunity to jumpstart the normalcy of my life once more. It helped me ground myself back to the ordinariness of my life, whatever that means. And I'm sure it was brought about by a lot of factors. For one, the retreat center in Magallanes in Tagaytay is very nice, and it's very conducive for such an activity. And of course, for 5 straight days, I was telling them that we were partaking of at least what I would personally consider as the yummiest vegetarian meals I've tasted in my entire life. So we retreat participants were saying amongst ourselves, those meals must have been prepared by the kitchen staff with soul and with tender, loving care. So I don't think they would have come out tasting that way if not for those important elements. I mean, they were really, really good. But really, I think at the core of that retreat, which I think is the essence and has made the most difference, is silence. And one of the most vital and valuable and practical ways of silencing the mind is through meditation, which in fact we were doing several times a day in that retreat. Since I will be focusing on the scientific aspects of meditation, while Sister Jayanti will be touching on the spiritual aspects of it, I'm not sure if you guys are already familiar or already aware of this, but there are specific mental states that can actually stimulate the brain in such a way that it can promote the growth of specific important brain regions. And one of those specific states is silencing the mind through meditation. This is actually a direct quote from Dan Siegel. Dr. Dan Siegel is a renowned professor of psychiatry at the UCLA School of Medicine. Next slide, please. So as we speak, there are actually a lot of types of meditation that you can try to learn. Personally, though, for me, the specific practice I go for is mindfulness meditation. So just by a quick show of hands, may I know who among you here in this room is familiar with mindfulness meditation? Or at the very least have heard of the term mindfulness? Yeah, so quite a number of you. So mindfulness is a very popular form of meditation. It's actually been in the mainstream for a while now. But historically, the earliest researches on the clinical use of meditation, when I say clinical use of meditation, I'm talking about its application in medicine and health in general. It was actually conducted even way back in the mid-70s and early 80s. So specifically in 1974, Doctors Herbert Benson and John Beery, who are both from Harvard Medical School, came up with the concept of what they call the relaxation response, which is the body's response or natural state when it is not perceiving any stress or threat. So hopefully all of us here, after having meditated, is in that state of relaxation response. And on the other hand, there is what we call the stress response, which was described by Dr. Hans Selye in the 1950s. So Hans Selye was considered to be the father of stress research. So the stress response is the opposite of relaxation response. Now, going into specific researches, in 1978, Dr. Benson and his colleagues conducted pilot studies on meditation as specifically applied to anxiety states or anxiety disorders, which generally showed very positive results. Whereas in 1972, Dr. John Kabat-Zinn, who is from the University of Massachusetts, developed a program called the MBSR, or the Mindfulness-Based Stress Reduction Program, which is an 8-week program on mindfulness. May I know who among you here is familiar with Dr. John Kabat-Zinn? Dr. June? So I think some other participants are familiar with him. He is actually the main proponent who brought mindfulness practice into mainstream medicine. And in fact, the MBSR program, since it was launched in 1982, it's been adopted by over 720 centers worldwide. Next slide, please. So also in 1991, for the very first time, the use of meditation, specifically mindfulness meditation, it was conducted in what was considered back then it was conducted among treatment-resistant individuals. So an example of that condition, which we consider the prototype, which is because it's really difficult to manage, would be borderline personality disorder patients. So these are patients or individuals who are chronically depressed. They have a very hard time regulating their emotions, and therefore they are very prone to anger outbursts. They also have a very unstable sense of self, unstable self-image, as was what we call it. And most importantly, these are the people who would engage in recurrent suicidal behaviors. So historically, they may have repeated suicidal attempts or self-injurious behaviors. And this particular study was spearheaded by Dr. Marcia Linehan, who in fact formulated a specific psychotherapeutic approach called DBT, or dialectical behavior therapy. So in her research, the patients were noted to show significant reductions in self-injurious behavior, which, as I was mentioning a while ago, is very characteristic of borderline patients. So there was also the research of Teasdale in 1995 among patients with recurrent depression who showed reductions in depression relapses with regular meditation exercise or meditation practice. So why the huge interest in these research directions? So the main reason for that is because in the earlier decades, the most common psychiatric conditions or disorders have been linked to what we call the wear and tear. Have you heard of that term? So wear and tear of the body, and of course that includes the mind. No? So back then, most of the psychiatric issues were attributed to this wear and tear phenomenon. And this wear and tear is said to be caused by overexposure to stress hormones, the most implicated of which, or the most notorious of which, is cortisol. So are we all familiar? Have we all heard the term cortisol? So it's a stress hormone that, as it increases in the body, the higher levels of cortisol we have are presumed to be detrimental. And this high cortisol levels means that we are at increased risk for many mental health problems like depression, anxiety, sleep problems, or even other non-psychiatric issues like digestive issues, weight gain, which we all know is also related to other medical issues like diabetes, hypertension, just to name a few. So we also have what we call inflammatory cytokines, which, just like cortisol, are considered as bad guys. And they're what we call offenders to the health and contribute to the wear and tear of the brain and the rest of the body. So when this happens, our brains are considered to be in a state called allostatic overload, which is in contrast to the adaptive and ideal response to normal challenges of life, which is what we call allostasis. We're all familiar with the term homeostasis, right? Which is the normal or the usual ideal state. So in other words, allostasis and allostatic overload are opposing states. just like the relaxation response is the opposite of the stress response. So simultaneously, at around that period, or maybe shortly after that period, other researches reported other important but somewhat contradictory findings, which was that, as you can see in the slide, the brain, when positively and persistently stimulated, actually underwent tissue growth, repair, and regeneration. And this is what we refer to as the principle of neuroplasticity. So the saying, you use it or you lose it, actually applies to the brain. Are you familiar with Christopher Reeve? Who among you here are the batang 70s? Who are now the titos and titas of Manila? I don't know if you remember that, but in the mid-90s, Christopher Reeve actually figured in a horseback riding accident. Yeah? Which rendered him paralyzed from the neck down. And the dogma of neurological science back then is if you have a massive stroke or if you have a spinal cord injury from that point down, it is impossible for you to feel anything or to move any part of your body from from the neck down. But you know what happened to Christopher Reeve, right? So he defied the laws of neurological science by undergoing a specific program called Activity-Based Recovery, or ABR. First, I think the first thing that he was able to do was to move his left index finger, and then much later on, he started to feel something. So in other words, at the end of the day, he was able to regain, I think, as much as 20% sensory function and as high as 60% of his motor function. In fact, what he died from is completely unrelated from that because he had a cardiac arrest, I think, at the age of 52, if I remember correctly. So that, I think his story exemplifies this principle of neuroplasticity that I'm talking about. So more importantly, the principle of neuroplasticity strengthened the link between learning and neurogenesis, which means brain repair and regeneration, to enriched environments. And an example of that enriched environment is meditation, or silencing the mind through meditation. And I wanted to include this in my presentation because neuroplasticity has since been adopted as the new paradigm in neuropsychiatry. So as I was saying earlier, if you suffer a stroke or spinal cord injury, then you're expected to not feel or move anything. That has totally changed now. Okay, so through the years, further studies have also supported the theory of neuroplasticity. For instance, EEG studies have linked meditation to changes that are consistent with increased brain activation and neurogenesis. And on the side, there are also studies on specific meditation techniques like transcendental meditation. Have you heard of, anybody here has heard of TM or transcendental meditation? So it has shown that in the EEG patterns, that those who practice transcendental meditation shows similar changes changes that are similar to the deepening calm and introspection that happens when we are about to fall asleep. You get what I'm saying? So, and this is precisely the reason why when we are meditating, it is not very uncommon that we fall asleep, which we would not want to happen, ideally, unless that's your goal. Because I actually have some patients who I would advise certain relaxation exercises, such as there's a very effective relaxation exercise called the autogenic relaxation, which involves going through the different parts of the body, and it's almost like a self-hypnosis, and telling yourself suggestive words like heavy, relaxed, comfortable, and warm. So that's autogenic. There's also what we call isometric and cue-controlled exercise, which is also going through the different parts of the body, different muscle groups, and doing alternate contracting and relaxing. So for my patients who have difficulty falling asleep, I would advise them to do that, and they're quite effective for them. So what happens is, if you are properly meditating, instead of generating slow theta waves or delta waves in EEG, which is typical of stage 1 sleep, which is what happens when we're about to fall asleep. When you're meditating properly, in the EEG, you would instead generate high-frequency theta waves or theta activity, which is consistent with increased attentiveness. So instead of falling asleep, you would be more attentive. That is what we call wakeful relaxation or waking state hypnosis. And for the mental health professionals here, it is related to Sigmund Freud's free association state, which falls under classic psychoanalysis. So there was also another study conducted on Tibetan meditation. Have you heard of Tibetan meditation? And this particular study showed that the Tibetan-trained meditation experts were in fact able to intentionally or consciously induce EEG changes that are indicative of increased learning. Okay? So meditation, as we speak, is really considered as the missing link in being able to consciously regulate ourselves, specifically our minds. So this may be a little Greek to you, but I just wanted to include this in my presentation because all of the research on meditation converge on one specific and very important region of the brain, if not the most important, which is what we call the PFC, or the prefrontal cortex. So if you look at the picture on the slide, this is the picture of the brain, the side view of the brain, and that red part, or the pink part, is what we call the prefrontal cortex. And if you look closely on the functions of this PFC, it is like the ultimate wish list for the highest and most ideal potential in man, because it covers all the basic functions like our ability to remember, our ability to selectively focus and concentrate on something, our ability to effectively plan and carry out those plans, our ability to regulate emotions. The PFC is also responsible for our ability to empathize with another individual, morality, problem solving, and even our body awareness, which is what we call proprioception. So, because PFC, or the prefrontal cortex, is intimately linked to the other important brain regions, so I don't need you to remember all of this, I just want to point out that the PFC is, just like in an orchestra, it is considered as the conductor of the brain symphony. It is the main conductor of what happens in the brain. And that is why PFC plays a central role in modern research and meditation. So how about meditation and psychotherapy? You think there might be a relationship between the two? So in psychiatry, the considered ideal approach to almost all psychiatric disorders, whether depression, anxiety, bipolar disorders, schizophrenia, addictions, is a combination of meditation and medication and psychotherapy. Therefore, what I'm trying to say here is that psychotherapy is an equally vital or valuable aspect in treatment. In fact, for mild conditions like mild depression or mild anxiety, psychotherapy can be a standalone. meaning you don't need to give medications for mild cases. And interestingly, for the past few decades, researchers have been studying the similarities between meditation and psychotherapy. So, in relation to this, I'd like to discuss a little bit about hemispheric dominance in the brain. So I'm sure most of you, if not all of you, have come across this in pop psychology. No? If you're asked the question, have you been asked the question, are you right-brained or left-brained? So it brings up the question of whether which side or hemisphere of the brain is more dominant for you. So if you, again, you look at the picture on the slide, this is the brain from a top view. So you can see that it is divided into two parts. There is the right hemisphere and there is the left hemisphere. So generally, if you're the type of person who is mostly analytical, methodical, if you're more intellectual than you're more emotional, then it is said that you are left-brained. And as you can see in the figure, the left hemisphere is the one that is mostly involved in brain functions like sequencing, linear thinking. It's responsible for mathematical abilities and factual and logical thinking. On the other hand, if you're the type of person who tends to be more creative or artistic or more emotional than intellectual, you're said to be more right-brained. And again, as you can see in the picture, the right brain is the one that is more involved in feelings. It is responsible for our ability to visualize or imagine, responsible for intuitive thinking, as well as holistic and artistic thinking. So that is what we refer to as lateral specialization of the cerebral hemispheres. Now, from the perspective of meditation and psychotherapy, research have shown that the left hemisphere, which is also called the verbal expressive hemisphere, it is the one that is preferentially related to optimistic or positive thinking. It is also related to us being able to feel positive affects or feelings, analytic processing, and approach behaviors, as compared to avoidant behaviors. Now, conversely, the right hemisphere, which is also called the sensory motor receptive hemisphere, supports worst-case scenario or catastrophic thinking. It's also responsible for aversive or negative feelings, synthetic processing, and avoidant behaviors. So, how does meditation and or psychotherapy alter the hemispheric lateralization? There are two important mechanisms that we need to consider and are shared by meditation and psychotherapy, which is first is stress reduction or relaxation, and the other important mechanism is heightened attention and therefore enrichment of learning. So these two mechanisms are the ones that are directly responsible for creating the change in meditation and psychotherapy. So, for instance, it has been noted that a balance between these two hemispheres leads to greater access to suppressed emotions and repressed trauma, which therefore leads to, it opens the way for greater verbal expression, which is very important when we are doing psychotherapy, and possibly gaining deeper insight or corrective emotional experience, which creates the eventual change. So there are also complementary findings that when one practices mindfulness meditation specifically, for instance, there is a left lateral shift that happens. So from the right dominance, you become more there's more dominance of the left hemisphere. And this leads to enhanced emotion regulation. It may also possibly explain why mindfulness meditation helps prevent relapses in depression, as well as increase resiliency. So, in relation to this is also the clinical model, which proposes that the most common psychiatric disorders, again, we're talking about depression, anxiety, PTSD and other trauma states, ADHD, addiction, all of these are said to be a syndrome of what we call hypofrontality. Remember the prefrontal cortex that I showed earlier? So it is said that psychiatric disorders are caused by a dysfunction or a decreased functioning of the prefrontal cortex. So in a nutshell, the studies on meditation and psychotherapy point towards the idea that the human mind and the human brain have a much greater capacity for healing and integration than we previously thought it was capable of. So how does one practice mindfulness specifically? There are basically 5 modes of mindfulness practice in the traditional sense. That would be mindfulness of the body, mindfulness of sensitivity or mindful sensitivity. There's mindfulness of mindset, mindfulness of mentality, and loving kindness. I only have 20 minutes, so I won't be able to go through all of this, but I think I will be sharing with you the simplest and most basic practice I'm being asked to wrap up, which is mindfulness of the body. So just very quickly, we do this by making use of the breath as the focal point. So when we are meditating, we make use of the breath as our focus of attention, because if you think about it, it is the breath that grounds us to the present moment. Yeah? Why? Because the breath is happening all the time, right? So when we connect to our breath, we basically connect to the present moment. And as John Kabat-Zinn said, this is my favorite part of his meditation tracks. He always says, as long as you're breathing, there's actually more right with you than wrong with you. That's very practical, right? So mindfulness practice is very much in harmony with the principle of what we call mind-body medicine, or what is sometimes called integrative medicine. Sometimes we would refer to it as participative medicine, where the patient or the individual takes an active part in and fully engages in his or her healing. And I believe this is the general trend nowadays, because not only in mental health, but in health in general. I think gone are the days when patients are satisfied with just letting the doctor tell them what's to be done. And you know, the term healthcare, I think, is a misnomer. I think what we're basically doing is disease cure. Wouldn't you agree? Because out of the 10 times that we would go to the doctor, would there be a time that you would go to the doctor healthy? And you just go to the doctor because you want to maintain your health? I think every time you go to the doctor, there's something wrong with us. So I think it's more disease cure than healthcare. So I wouldn't have the time to go through these 7 important attitudinal foundations of mindfulness. But I would really advise you to check it out. It's available very much available in the internet. So there's non-judging, patience, just very quickly, adopting a beginner's mind, trusting oneself, non-striving. I just want to specifically focus on this last part, which is letting go. So in India, they have a very interesting way when they're trying to catch monkeys. They have a clever way of doing it. The strategy is to get a coconut husk, put a banana inside, and then they attach it to the base of a tree trunk. Yeah? And what they do is to drill a hole in the coconut husk that is just big enough for the monkey to put its hand inside it. But when the monkey grasps the banana and tries to take it out of the coconut, it's not possible. So it's cleverly crafted in that way. So if you think about it, all the monkey needs to do to be free is to let go of the banana. But guess what happens? Most monkeys actually opt to hold on to the banana and be trapped where they are. Does that sound familiar? So, in spite of our human intelligence, our thinking can get caught up in the same manner. There are certain experiences that the mind gets trapped into, whether pleasant or unpleasant. If it is a pleasant experience, what do we want to do? We want to hold on to it, and we want to prolong it. If it's an unpleasant experience, what do we want to do? You want to get rid of it right away. If it's unpleasant or painful or frightening. No? So in mindfulness practice, we intentionally put aside the tendency to hold on to some experiences or reject other experiences. What we basically do is to just observe our minds, either grasping onto something or pushing away something. So we need to remind ourselves to make an attempt to let go of those things. So, what is your banana? So last few slides. This is something that I show to all of my patients whenever I introduce to them the concept of mindfulness. This is the spectrum of time. So as you can see, there's the past, the present, and the future. So strictly, if you are not in the present moment, you can only be in either two time frames, which is past or future. And the general rule, for example, in depression and anxiety is if you're more in the past than in the present, you're bound to be more depressed. Or if you're more in the future than in the present, you're bound to be more anxious. I think that's a very sound principle to remember. So whenever you're feeling anxious or depressed, maybe all you need to do is to just sit quietly and observe how much of yourself are really here or in the past or the future. So this is me with Dr. John Kabat-Zinn in one of his conferences in Harvard in 2015, I think. So these are additional attitudinal foundations. There's actually an approach called self-compassion meditation, which is part of mindfulness practice. So this is a website which you may want to check out. It's called www.mindfulnessexperience.org if you want to learn more about meditation. So meditation is basically a way of being to connect us with our capacity to see and embrace the actuality of things as they are in the moment in a way that is healing and transforming. And as a way to end, I just like to quote Buddha himself, who said, "Refuge to the man is the mind, and refuge to the mind is mindfulness." So thank you for your attention.